Good evening. This is All India Radio Kohima. I'm Jonas Yentan with Evening News. The headlines. Nagaland launches Chief Minister Health Insurance Scheme. State Chief Minister Neiphiu says Chief Minister Health Insurance Scheme to assure better access to healthcare services than ever before. President Droupadi Murmu flags off passenger train to connect Meghalaya and Nagaland. And Phek Niuland districts win U-14 Nagaland Sepak takraw championship. Now the news in detail. Nagaland today launched Chief Minister Health Insurance Scheme, CMHIS, a free and cashless hospitalization treatment for various ailments to all citizens of the state. The scheme was officially launched by Chief Minister Neiphiu at State Banquet Hall, Chief Minister's residential complex in Kohima. CMHIS is one among the first state-specific welfare scheme which aims to alleviate financial hardships due to hospitalization expenses and to prevent inaccessibility to medical care on account of affordability. The scheme is implemented in convergence with Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, APPM-JY. The scheme is also a step towards fulfilling the Nagaland Sustainable Development Goal Vision 2030. The beneficiaries under the scheme are categorized into CMHIS Employees Pensioners, EP, and CMHIS General. CMHIS EP category will include state government employees who are eligible for monthly medical allowances or reimbursement of medical expenses under Medical Reimbursement Scheme, namely regular employees, pensioners, serving legislators, ex-legislators, employees of state public sector undertakings, corporations and autonomous bodies, work charge employees on scale pay, and their dependent family members. CMHIS General category will comprise of all indigenous and permanent residents of the state who are not beneficiaries under the APPM-JY or any other public-funded insurance scheme of the government and who are not covered under CMHIS EP. Non-dependent family members of CMHIS EP categories are employees without PIMS number, contractual, ad hoc, fixed pay employees of the state government and contractual employees under various CSS and their household members are also included under this category. The sum insured for CMHIS general beneficiary families will have coverage of up to 5 lakh rupees per annum on a family floater basis similar to ABBP-JY. This scheme will be available through a wide network of nearly 20,000 Ayushman Bharat empaneled hospitals across the country. While in CMHIS EP, government servants and pensioners will have coverage of up to 20 lakh rupees per family and also have access to nearly 1,500 CGHS empaneled hospitals. The beneficiaries can avail the benefits by enrolling themselves online through the website cmhis.nagaland.gov.in. Chief Minister Neiphiu has said that Chief Minister Health Insurance Scheme CMHIS will give assurance to the people of the state to have better access to healthcare services than they had ever before. He said this while launching CMHIS at Kohima today. The Chief Minister said CMHIS will expand the coverage of insurance benefits over and above those being covered under Prime Minister's Ayushman Bharat scheme. He expressed confidence that this scheme will prevent substantial expenditure hardships that are occurred in hospitalization. Rio said it is also an opportunity for the private hospitals in the state to treat patients and get assured payments. He said this is the first time that private hospitals are getting an opportunity to get empaneled and treat patients not only from the general population but also from among government servants who are, as of now, going for treatment outside the state. Rio informed that all government hospitals in the state will also be empaneled to provide inpatient treatment under the scheme. He maintained that revenue earned from the insurance scheme can be used by the hospitals for improving delivery of health services in their respective facilities. The Chief Minister said launching this scheme is a red-letter day for all. However, the real test will be on how it will effectively be implemented. To this, he appealed to all beneficiaries, whether it is government servants, pensioners, legislators, villagers, or town dwellers, to enroll themselves on the online enrollment portal, which is open now. In case they are not able to self-enroll, they should avail the free assistance that is being provided during the next fortnight all over the state at designated locations for e-verification, Rio added. The Chief Minister also appealed to all hospitals to immediately enroll on the online portal so as to provide services immediately. On the occasion, the Chief Minister released the policy documents of the scheme and launched the State Beneficiary Portal and Beneficiary Enrollment Drive. Rio also distributed the Ayushman CMHIS card to 3 beneficiaries, as well as empanelment certificates to 5 hospitals, namely Oking, CIHSR, Olive, District Hospital Mon and Longleng. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on News on Air app and YouTube channel AIR News Kohima. President Droupadi Murmu today virtually flagged off a passenger train to connect Meghalaya and Nagaland. This train will run between Sukhumvit in Nagaland to Mentipatthar in Meghalaya via Guwahati. Speaking on the occasion, the President said the central government is giving special attention to road and railway connectivity in all the northeastern states. She expressed confidence that various projects related to roads and railways will increase tourism opportunities apart from enhancing trade and transportation in the region. International Institute of Democracy and Election Management under the Election Commission of India today organized a virtual training program for police officers in connection with the forthcoming general election to the Legislative Assembly of Nagaland, Meghalaya and Tripura. Trained police officers will act as state-level master trainers or resource persons for down-the-line training in their respective states. Altogether, 20 police officers from Nagaland attended the training program. Phek District defeated Wokha District, while Niuland District defeated Kohima District to lift the Under-14 Sepak takraw Regu event for boys and girls categories, respectively, at the 14th Inter-District Catch Them Young Tournament 2022 organized by Department of Youth Resources and Sports. The 3-day event saw 16 districts participating in the championship at IG Stadium Kohima, which drew to a close this afternoon. In the boys category final, Phek District, despite losing the first set 9-21, made a quick recovery in the second set, winning by 21-12, and took the charge in the third set by winning 21-17. Longleng and Mogukchung were the semi-finalists of the boys category. In girls category, Niuland District dominated the final match against Kohima District, winning in straight sets 21-19 and 21-15. Mogukchung and Dimapur were the losing semi-finalists of the girls category. Advisor for Youth Resources and Sports, Zale Neka, graced the closing ceremony and gave away the awards to the winners. In his speech, Zale viewed that sportspersons from the state have the capability to improve further and become successful if they are willing to sacrifice and dedicate themselves and obey their coaches. On the state failing to win any medals in the recently concluded 36th National Games 2022 held at Gujarat, Zale said in some areas the department and the government might have failed to provide necessary requirements. However, everyone is equally responsible and impressed upon the need to revamp and review the mindset by evaluating the failure. And now to end the news, here are the main points again. Nagaland launches Chief Minister Health Insurance Scheme. State Chief Minister Neiphiu says Chief Minister Health Insurance Scheme to assure better access to health services than ever before. President Droupadi Murmu flags off passenger train to connect Meghalaya and Nagaland. And Phek and Niuland districts win Under-14 Nagaland Sepak takraw Championship. That is all we have in this evening news bulletin. Good night.